Hi, today we will read about upper airway infections, rhinitis. Rhinitis, viral rhinitis is common cold. Upper airway infections are common conditions that affect most of us on occasion. Some infections are acute with symptoms that last several days. Others are chronic with symptoms that last a long time or recur. Patients with these conditions seldom require hospitalization. Rhinitis definition. Rhinitis is a group of disorders characterized by inflammation and irritation of the mucous membranes of the nose. It may be classified as allergic and non-allergic. Pathophysiology. Non-allergic rhinitis may be caused by a variety of factors including environmental factors such as changes in temperature and humidity, odors or foods, infection, age, systemic disease, drugs like cocaine or prescribed medications, presence of foreign body. Drug-induced rhinitis associated with use of antihypertensive agents and oral contraceptives and chronic use of nasal decongestants. Rhinitis also may be a manifestation of an allergy, thus it is called as allergic rhinitis. In rhinitis, the mucous membranes lining the nasal passages become inflamed, congested and edematous. The swollen nasal conchae block the sinus openings and mucus is discharged from the nostrils. Signs and symptoms. Signs and symptoms are of rhinorrhea, that is excessive nasal drainage or runny nose, nasal congestion, and nasal discharge is purulent if with bacterial rhinitis. Nasal itchiness, sneezing, and headache may occur, especially in sinusitis. Medical management. If symptoms suggest a bacterial infection, an antimicrobial agents will be used. In allergic rhinitis, tests may be performed to identify possible allergens. Depending on the severity of the allergy, desensitizing immunizations and corticosteroids may be required. If viral rhinitis is the cause, medications are given to reduce and relieve the symptoms. Pharmacologic therapy. Medication therapy for allergic and non-allergic rhinitis focuses on symptom relief. Antihistamines are administered for sneezing, itching and rhinorrhea. Oral decongestant agents are used for nasal obstruction. In addition, intranasal corticosteroids may be used for severe congestion, and ophthalmic agents are used to relieve irritation, itching, and redness of the eyes. Nursing management. In nursing management, we have to teach the patient for self-care. The nurse instructs the patient with allergic rhinitis to avoid and reduce the exposure to allergens and irritants such as dust, molds, MOLDS molds, animals, fumes, odors, powders, sprays, and tobacco smoke. The patient is instructed about the importance of controlling the environment at home and work. Saline nasal or aerosol sprays may be helpful in soothing mucous membranes, softening crusted secretions, and removing irritants. The nurse instructs the patient in the proper use of and technique for administering nasal medications. To achieve maximal relief, the patient is instructed to blow the nose gently before applying any medication into the nasal cavity. In case of infectious rhinitis, the nurse reviews with the patient about hand hygiene technique as a measure to prevent transmission of organisms. The nurse teaches methods to treat symptoms of the viral rhinitis. In the elderly and other high-risk populations, the nurse reviews the value of receiving vaccination in order to achieve immunity prior to the beginning of the flu season. Thank you.